Everyone definitely deserves access to care. We should all be able to get the care we need, when we need it, how we need it. There's a lot of barriers that the women in our community are facing in order for them to come for care. One, of course, is always the financial issues. Some of our women don't have the insurance to come in, and even though we have the Cancer Screening Project providing free care for these women to get their mammography, their pap smears, their colorectal screening, and for men, prostate screenings in a timely manner, they're still not coming in. Through the American Cancer Society, we currently have a grant working with some of our community partners. What we're trying to do with that grant is assess what are some of the healthcare system barriers, some of the community barriers, some of the barriers that our patients just face trying to get into the system that are preventing our women from getting the care that they need. Some of the barriers are transportation. They don't have the means to get to their appointments, and they don't know about the resources that are available to them so that they can access transportation. We also have some of our women who just have other competing priorities. Is there enough opportunities for them to come in at a time that's convenient to them, that there's no childcare issues? There's fear about getting the mammogram, that it hurts. There's fear about what the results will find. There's fears if there's a positive finding, what next? So you have to also address the education piece in order to pass by those barriers of fear. Can we put in place some of the resources so that care can be achieved? No matter what their ethnicity, no matter what their income, no matter what their socioeconomic status, making sure that we get rid of any other barriers and provide all the resources necessary so everyone can get the care they need. Without funds for these free screenings, for these free follow-up care. A lot of women from minority communities who don't have insurance, who maybe have insurance but are not educated about their screenings, we would lose a lot of those women to cancer. So these grants from the American Cancer Society are critical to make sure that every woman is getting equitable care, is getting equitable education, and is able to access the healthcare system in a timely manner. I feel that the work that we're doing in the community are definitely making a huge impact in getting women in for care. And that's who I want to work with. I want to work with people who I can make an impact, but who deserve the same care as anyone else out there.